everyone. Myself Dr. Amrita Mishra, Associate Professor, Department of Prasuti Tantra Stri Rog at R.A. Poddar College, Worli, Mumbai. At the outset, I would like to extend my gratitude towards Mcim, Honorable VC MUHS, Dr. Kanetkar Madam, Dr. Director Ayush Maharashtra, Dr. Raman Ghungradekar Sir, our respected Dean, Dr. Sampada Sant Madam, my respected HOD, Dr. Manoj Gaikwad Sir, and all my colleagues and PG students who are working and who have been associated with my work regarding to the topic for today, which is Ayurvedic modes and modalities for infertility management. So the basic objectives or the specific learning objectives of today's lecture is the need assessment of infertility, what is the need or requirement of this lecture, and the knowledge regarding infertility. What are the Ayurvedic principles that govern this concept of infertility, the etiological factors, the diagnostic therapies which are available, management of infertility, which is very important as per Ayurveda, and the recent trends and some of the videos which will be reflecting the treatment or therapies pertaining to infertility. So first, coming to the need assessment, according to the one of the articles published in 2023 by WHO, which says that around 17.5% of adult population, which is 1 in 6 worldwide, is having this problem of infertility, and it is still growing. So that depicts the need why this pathological condition needs to be dealt with utmost sincerity and holistically. Also, the Director General of WHO, Dr. Tedros, has once reported and said that infertility does not discriminate. While he said that, he meant that infertility is not restricted to a particular class or a particular group of countries, be it developing countries or developed countries. It is on a high in all the sections and all the countries of the nation, and that is precisely the reason why we need to deal infertility with sincerity and holistically. So here comes into play the role of Ayurveda in this graving or growing problem which the world is facing, that is infertility. So what does Ayurveda has to say according to infertility? Firstly, coming to the etiological part or the principles which govern the concepts of infertility in Ayurveda, the basic concept which Ayurveda says is the concept of the shlok says Dhruvam Chaturnam Sannidhyat Garbhasyat Vidhipurvaka Rutu Kshetrambu Bijana Samagrayad Ankurad Yatha, which means that there are some elements which are important for fertility and for normalcy as well as for the treatment of infertility. Now, this concept they have compared with the development of plant from the seed. So the elements which they have mentioned is first is Rutu. Rutu is the compatible climate. So just as favorable climate is responsible or one of the very important aspects of development of plant from the seed, similarly compatible climate inside the uterus and other organs pertaining to reproduction is very, very important for conception. Second part is Kshetra. Kshetra is the fertile land. So just as the fertile land is very important for the development of plant, similarly normalcy of all the organs responsible for reproduction is very important. Thirdly, Ambu. Ambu is water or the nutritional elements. So just as the nutrition and water is important for the development of plant, without water and without nutrition it is literally impossible for the plant to develop from the seed. Similarly, if the nutrition is not there or there is deficiency of nutrition in the body of the couple, that is one of the factors of infertility. And last but not the least is Bija. Bija is the good quality of seeds. Just as the good quality of seeds is essential for development of good quality or the wholesome plant, similarly the good quality of male factors, that is the sperms, and good quality of ovum, that is the female part, is absolutely important for the development of healthy progeny. So there are several other aspects also which are mentioned as one of the etiological factors or hetus of infertility. So as we know that our acharyas such as Charak, Sushrut, Vagbhat, Kashyap have reiterated infertility in different principles and in the form of different principles. So these principles are in the form of various reproductive tract infections, because we know that if there is any sort of defect in the reproductive tract or pathology, then it adds to the cause of infertility. Similarly, the concepts that we have discussed earlier, such as Rutu, Kshetra, Ambu, Bij, they have been incorporated by the Acharyas under the different principles or the different entities in their texts, namely Charak, Sushrut, Vagbhat. So we all know the theoretical part, but how do we replicate these theories into practicalities? That is, how do we use these principles to find out and to diagnose the definite causes of infertility, so that we are able to manage it holistically and completely, and we are able to give a healthy child to the couple who is facing this problem of infertility. So firstly, as we all know, again there are different types of Vandhyatva which are mentioned in Ayurvedic texts. Vandhyatva means unable to conceive. Now here they have not only mentioned the couple who is unable to conceive once, but there are entities wherein the couple is able to conceive once, but later on the female is unable to conceive, or in cases where there is recurrent abortions. All those conditions are mentioned under the heads of infertility or Vandhyatva according to Harita. So as we all know, there are male and female aspects of infertility. The cause may be either male related or female related, and that cause may be either anatomical or physiological or pathological, or one thing which is absolutely and many a times neglected is the psychological factor. Rather, practically we see that many of the couples are having absolutely normal anatomy and physiologically, which is depicted in the form of different reports, but the problem lies in harmony and other psychological effects. Hence, the psychological factors should be taken into account absolutely seriously, so before and while treating the patients of infertility. So the causes of infertility are, as the statistics goes, male is 30%, female 30%, both 10%, unexplained 25%, and others which are not explained is 5%. So the possible cause of infertility may lie in any of the organs, reproductive tract, namely it may be in the form of some vaginal or cervical infections, it may be in the form of some space occupying lesions in the form of fibroids or polyps, or some anatomical defects in the uterus, such as septate uterus and other deformities, or there may be some space occupying lesion or infection in the fallopian tube which hampers the transportation of ovum into the uterus, thereby causing infertility. So when we see the statistical data about the factors, female factors of infertility, we get to see that ovulatory dysfunction accounts for 35%, diminishing ovarian reserve is 20%, tubal factors 30%, and endometriotic factors result in 10%. And the causes of male infertility, we know that there are immunological factors 5%, hypogonadism, varicocele, systemic diseases, sexual dysfunctions, undescended testes, and 34% causes as far as the male infertility is concerned is unexplained. So अगर सब तरह से देखा जाए तो there are different factors like male and female factors which need to be taken into account while we treat the patients. So in a nutshell, the male factors can be either genetic disorders or diabetes or ejaculation problems, varicoceles, and mainly lifestyle disorders which play a very important role in male infertility. Female infertility, as I already said, there may be any issue regarding Rutu, Kshetra, Ambu or Bij, such as any anatomical or physiological or pathological defect in the reproductive tract, or hypothalamo-pituitary ovarian axis. Now this cause is why it is important, because unless we know the cause, we will not be able to diagnose and treat the patient properly. For instance, if the problem lies with the fallopian tube and we are treating the entire male and female counterpart, neglecting the fallopian tube defect, it will not result in successful therapy. So firstly, we need to come to a consensus and a proper diagnostic confirmation as to what is the exact cause of infertility. And when all the causes are found to be normal, there is no defect in any of the reports, then we can think of the unexplanatory cause. This is what the modern medicine has to say. But according to Ayurveda, we need to have a holistic vision about the constitution of the body, be it dosha, dhatu, mala, and the entire constitution of the body, which is nothing but the cellular structures and different other factors and the prakriti or the constitution of the body. Unless we have an idea about the prakriti and the status of doshas in that particular body, we will not be able to have a successful therapy. So there is one more thing which plays an important role, is the circadian rhythm. So circadian rhythms are the 24-hour cycles that are part of the body's internal clock running in the background to carry out essential functions and processes. If there is disturbance in any of these circadian rhythm, be it in the form of sleep disturbances or in the form of diet or irregular pattern, then it leads to lifestyle disorders, and infertility comes into the entity of this lifestyle disorder. So circadian rhythm or the concept of dinacharya, which is mentioned in Ayurveda, needs to be taken into account very meticulously while we treat such patients. So this includes sleeping, walking, core body temperature, the immune system of the patient, the hormones, the metabolism, the cognitive functions, and body's reaction to stress. Diagnosis depends upon there is a standard format of diagnostic tools which are included for the diagnosis of infertility, which is ovulation testing, prolactin levels, histosalpingiography, ovarian reserve testing, then imaging tests, and different scopies and genetic testing is also important. But the most important is the clinical examination, and the most important responsibility of the doctor treating is to be a good listener. Unless the doctor is a good listener, then it will be very difficult to have an idea about the psychological condition of the patient. Sometimes the patient is not open to disclosing the factors which may be very important. Hence, it is very important to be a good listener as far as the treatment of infertility is concerned. From the male part, it is the semen analysis, blood grouping, CBC and Doppler studies which may be required depending on the cause. So what are the different modalities according to Ayurveda? As we all know, Ayurveda focuses on the normalcy of tridoshas, that is Vata, Pitta, Kapha, the normalcy of the Sapta Dhatus, Trimala, and there are other principles also like Samanya, Vishesh, Shatkriya, Kal, and different other principles govern. So how do we divide the treatment protocol? Firstly, it is the Aushadhi Chikitsa and the Shalya Chikitsa. Aushadhi Chikitsa is in the form of Shodhana and Shaman Chikitsa. Shodhan Chikitsa is cleansing of the body, detoxification of the body, which is done by doing Panchakarmas. And Shaman Chikitsa is in the form of herbal formulations which have the reference in our ancient Ayurvedic texts. Depending on the prakriti and the constitution of the patient, we need to formulate those medicines and prescribe to the patient. Depending on the stage of the disease, cause of the disease and prakriti of the patient, these medicines are to be prescribed. And Shalya Chikitsa constitutes some of the operative procedures which need to be done in case of anatomical defects maybe. So how is Panchakarma useful and what is Panchakarma? We all know that Panchakarma is the treatment to program our body, mind and consciousness, which cleanses and rejuvenates our body. So it is based on the Ayurvedic principle that every human is unique phenomenon manifested through the 5 basic principles of ether, air, fire, water and earth. So the 5 principles or the 5 karmas which come under Panchakarma are Vaman. Now how does Vaman help? Vaman helps in detoxifying the body. If there is oxidative stress which accounts for unexplained infertility, it is very important to go for Vaman therapy in both the partners. Virechan is the administration of purgatives which helps to relieve elevated pitta. Basti, as we know, in most of the gynecological disorders or yoni vyapadas, the major causative factor is Vayu, and the best therapy for the normalizing of Vayu is Basti. So Basti or enema therapy, that is rectal administration of medication, is of utmost importance in the treatment of infertility, as Vata is the active principle in the pathogenesis of these conditions. Nasya, it is said that Nasa hi Shiraso Dwaram. So nasal route of administration of oil-based medications is also very important. It improves the brain function, nervous system, hormonal functioning, and in the defects pertaining to hypothalamo-pituitary-ovarian axis. Then Rakta Mokshan, because toxins present in the gastrointestinal tract are absorbed into the blood and circulation throughout the body, and this condition is called toxemia. So to cover up or to have an answer to this condition, we can have Rakta Mokshan. And Uttar Basti is one of the speciality in gynecology, we can say, wherein we do the Kshetra Chikitsa using different types of oil preparations and instilling them in the uterine cavity for the management of infertility, so as to create a conducive environment inside the uterus for implantation and conception. So what are the medicines which are used? Firstly, in case of Basti, we can have a Yoga Basti Kram, where as oil preparation we can use Sahachar tel, Dashmul tel can be used, and in case of Trifla is also used, and for Asthapan Basti or for Niruha Basti we can use Trifla Kwat or Dashmul Kwat. Similarly, for Vamana we can use Panchatikta Ghruta or Tikta Ghrut. For Virechan also same thing can be used, or Gogruta can be used. There are different types of bastis which we usually give in the form of Yoga Basti, Kal Basti, Lekhan Basti, depending on what is the cause of infertility. For male also, there is an answer in the form of male Uttar Basti and Yog Basti, Vaman, Virechan for different causes of infertility. Now, what are the other drugs which are used? One is Shatapushpa tel. Shatapushpa tel is used in the management of ovulatory dysfunction. It is used as in Yoga Basti as oil preparation. Then different dravyas such as Dashmul, Ajmoda, Trifla, then Kashmiri Kutaj. Kashmiri Kutaj is used in torch infections or bad obstetric histories, Manjishtha, Lodra, and Uttar Basti can be given by using Falagrit, Shar tel, Til tel, Trifala and Bala oil. The kalpas which are used, there is a treatment called Sthanik Chikitsa which includes Pichu, Dhawan and Dhupan, and different preparations which are used is Jatyadi tel, Karanj tel, Shatadaud Ghrut, Nimba and Kshar Pratisaran in case of cervical erosion. Yoni Dhawan can be done by using Panchavalkal, Trifla, Nimba and Kamshi, and Dhupan can be done for using Aguru, Trifla, Ajmoda, Nimba, Gugulu, Haridra. Erendamuladi Basti can also be administered to the patient. And in case of PCOS wherein there is obesity, we can have Lekhan Basti along with Udvartan. Male infertility, there are different drugs which include Ashwagandha, then Shilajit also, and Musli, Shwet Musli, and Shukra Janan oil and Shukra Shodhan tel, which are mostly used. Other than that, Bala, Shri Gopal tel is also used, and Jivaniya Gun Siddha Bhruta can also be given to the patients. Kanchanara Gugul Vati is used in case of cystic related lesions if they are in the body or they are the cause of infertility. Kanchanar Gugul and Kuberaksha Vati can be administered to the patient. Other than that, Arogyavardhini, Kanchanar Gugul, Hingashtak Churna, mainly for Deepan and Pachan Chikitsa before Panchakarma. Kuberakshvati, Sahachar, Bhadranimba Kulatha and Varunadi Kwat can be used. Now there is another important factor which is sthanic pathology, that is local infection, reproductive tract infections, which are usually neglected, but they are one of the important factors as far as the female is concerned. So for the treatment of local infections in the form of vaginitis, cervicitis, cervical erosions or Nabathian cyst or follicles, one can go for Pichu Chikitsa in the form of Jatyadi tel Pichu or Nimba tel Pichu. and you can also go for a Yoni Dhavan in the form of Panchavalkal or Trifala Kwat to be used as Yoni Dhavan. Cervical erosion can be treated using Shara Pratisaran. So there are different procedures which are done, and other than that, Uttar Basti is very important, but it should be done with all aseptic precautions in a proper setup where there is no scope of infection. Otherwise, there is a grave complication which is possible in the form of endometriosis and peritonitis. So Uttar Basti can be given in a with all aseptic precautions in a sterile environment, and the drugs which are used are maybe in the form of Yashtimadu tel or Bala tel or Kshar tel or Falagrut or Falakalyan grut, depending on the history of the patient and depending on the prakriti of the patient. Churna and Varti is also advocated. Varti Chikitsa is also advocated in patients for local infections. Also, diet and exercise. Healthy diet is very important for the lifestyle modulation and modification so as to have a healthy progeny. So, diet incorporating the sattvic ahar and in the form of sprouts, fresh fruits and vegetables, depending again on the prakriti of the patient, because as we all know, every body has a different constitution depending on the proportion of Tridoshas and Saptadhatu and Agni status. So depending on that prakriti of the patient, one needs to design the diet protocol for the patient and yogic practices in the form of Anulom Vilom Pranayam, few exercises and yogic asanas also for the management of infertility. There are several researches which are done which go to indicate that yogic practices have led to successful fertility. So in a nutshell, I would like to emphasize the role of Panchakarma, diet and Ayurvedic principles, and depending on the principles of Ayurveda in the form of Samanya Vishesh Siddhant, Tridosh, Saptadhatu, we need to focus on the Ayurvedic aspects of infertility, the causes of infertility. Depending on that, we need to design the Ahara, Vihara, Dinacharya of the patient and play a very, very important role in the psychological and counseling of the patient according to the principles of Ayurveda, and then we can have accordingly, if we plan the medication and the therapy of the patient, we definitely have a successful Ayurvedic treatment for infertility. We do have success stories and we are treating such patients in our OPDs and IPDs of R.A. Poddar College, R.A. Poddar M.A. Poddar Hospital at Worli in Prasuti Tantra Stree Rog Department. And we have very good success rate. We have the entire list of patients which are benefited by the management of infertility using the principles and using the modes and modalities that I have presented in front of you. So I hope this helps, and I hope these modes and modalities play an important role and improve the fertility rate of our society, and more number of couples are benefited and we are healthy and we are able to give a healthy society and a healthy progeny. Thank you very much.